Assalamualaikum. I'm Dr. Muhammad Ali Rabbani, and today we are going to discuss the midbrain, the cross-sectional anatomy, the internal structures of the midbrain, and that is the lecture, the part of the brainstem lectures that I'm conducting, and it's the part of a larger series of the lectures of neuroanatomy. If you have not been following till now, please to look through our channel. In this playlist the video is in, you will see the lectures of general anatomy of the nervous system, all the lectures of the spinal cord structure, ascending, descending, intersegmental tracts, the lesions, and we have gone through medulla oblongata, the brainstem features, the medulla oblongata, cross section, lesions, pons, cross sections, lesions, and here we are starting with the midbrain. And stay tuned, we are working towards completing the neuroanatomy. The following lectures after the brainstem will be for the cerebellum. Okay, let us start. So the midbrain, the gross anatomy of the midbrain we have discussed in the previous lecture. It is the part that is starting above from the pons and goes and above in the and will in the diencephalon. And anterior aspect you will be able to see these crus cerebri, part of the peduncles, and between them interpeduncular fossa. Through that you are able to see this posterior perforating area, and then there is a part of diencephalon, mammillary bodies, tuberous caninium, optic chiasm and tracts, and so on. Importantly, anteriorly you can see exiting oculomotor nerve, and from the back coming the trochlear nerves. The picture from the back is more prominently highlighting the point of the cross sections that we are going to make. On the back there are two prominent pairs. These are superior colliculi and these are inferior colliculi, responsible for visual and auditory signal relay, and we will see them shortly. And below it, below inferior colliculi, the trochlear nerve emerges, that it goes around the brainstem and goes front, and this is the only cranial nuclei out of 12 that is exiting from the posterior aspect of brainstem. So let us start. So this is the picture that we are going to be following. This is the cross section of the midbrain. That is the basic structure that we are going to follow. Two things that you keep in mind: the central canal. This is the central canal, aqueduct of Sylvius. Aqueduct of Sylvius. Very commonly this name is also used. Aqueduct of Sylvius, the central canal that connects the fourth ventricle below with the third ventricle above. Then there is Substantia nigra. This is a structure that in the fresh specimen relatively it's found to be darkly stained, and you might know this name from the Parkinson's disease that is responsible for producing dopamine, nigrostrial pathways, and affect disease of this area leads to Parkinsonism. These two structures, the presence of central canal and the substantia nigra, divides the midbrain as follows. The part of the midbrain that is behind central canal, that is called tectum. The part of the midbrain that is anterior to it, that is called cerebral peduncle. Basically this whole area, like this whole area is cerebral peduncle. Of course there is an overlap between two, so this is called cerebral peduncle, and that will lead to this interpeduncular fossa. This cerebral peduncle is further divided into two parts. The part that is between the central canal posteriorly and the substantia nigra anteriorly, that is tegmentum. This tegmentum will include area like this. This will be the tegmentum area, the tegmentum, and the rest of the remaining part, the part that is anterior to the substantia nigra, that is the crus cerebri. So keep these things in mind, and we will be following these as we move along in our lecture. So let us divide it into two parts. The part that is the upper one, that is at the level A, that is at the level of superior colliculus, and then there is this one, the B, that is at the level of inferior colliculus. Let's make this picture small and start from here. Okay, the labeling that we have already done. Central canal, you can see in the back, it is the aqueduct of Sylvius. that is running between the third ventricle above to the fourth ventricle below, and it is running in the midline. And it is a very important structure in the clinical aspect. Of course, anatomically it's very important for the circulation, and clinically this is the choke point. This is the point of the CSF circulation system that is most commonly blocked due to congenital anomalies. Congenital hydrocephalus is majorly due to the block of this central canal, and proper name is aqueduct is proper name. Aqueduct of Sylvius is the proper name. Then there is Substantia nigra present between the Tegmentum and the Crus cerebri, darkly stained area. Let me make this amendment so that we may not go through this again and again. Okay, so this is what we were talking about: aqueduct of Sylvius, Substantia nigra, periaqueductal gray area. And then as this area was at the level of superior colliculus, it can be seen posteriorly. This raised area is superior colliculus, and between the subcolliculi there are fibers that are joining the two colliculi. For the communication between them, those are known as commissures of superior colliculi. Similarly, there are inferior colliculi. At this level, they are majorly responsible for auditory signals relay, and between them there will be commissure for inferior colliculus. Now let's start with the descending tract. The descending tract moves down through the crus cerebri as it goes down from the base of the pons and the pyramid of medulla till it crosses the midline. So here you can see the corticospinal and corticobulbar tracts that houses about this two-third of this crus cerebri. This is housed by the corticospinal and corticobulbar tracts. You can keep that in mind. Now you are adding corticobulbar in addition to the corticospinal tract. The head end is here and the tail end fibers are going from the lateral aspect. It will go down. It is going corticobulbar and corticospinal tracts, and then there are other descending tracts. For example, the fibers that are coming from cerebral cortex going to the pontine nucleus, corticopontocerebellar tract, and other fibers that are coming from the cortex. So they are present in rest of the crus cerebri. So it contains those fibers that are coming from cerebral cortex. There are frontopontine fibers in this 1/6 of the area. 1/6 of the area, and 4/6 or 2/3 of the area is for the corticospinal tract. So there is frontopontine fibers coming from the medial aspect. There is temporopontine fibers. There are parietopontine fibers. There are occipitopontine fibers that are descending on this lateral aspect of the crus cerebri, and they are going to go and relay into the pontine nuclei and on the way to the cerebellum. The similar one you can see on the other side: corticospinal and corticobulbar fibers, frontopontine on the medial aspect, all the other pontine, the parieto, the temporo, the occipitopontine fibers on the lateral aspect. Next, let us start with the spinal sensory ascending tracts. Fasciculus gracilis and cuneatus, they are part of DCML. First order neuron was here, they travel up, relayed here in the nucleus gracilis, nucleus cuneatus, cross the midline, moved up, and it's gradually going on the little lateral aspect. Here you will be able to witness them here and here, and there we are seeing that right here. Medial lemniscus. I would like to remind you that in the medulla oblongata it was absolutely near the midline. In the pons it was little away from the midline. In the midbrain it is relatively later to the midline now. So this is medial lemniscus. here in this picture, I think I would be better off drawing it like this. They cross the midline. Initially there is very close to the midline, but gradually goes to the lateral aspect, and here you can see them lateral to the midline. Next to the medial lemniscus, that is medial lemniscus, both levels you will be able to see them. Next is the trigeminal lemniscus. This was the fiber that lemniscus contains the fibers coming from all the sensory nuclei of the trigeminal nerves. The fibers, if you have not seen them, I would recommend going back to the video of the pons. In the cross-sectional anatomy, I have discussed the trigeminal nucleus in detail. The entering fiber of the trigeminal nerve enters here, and it some synapse on the main sensory nucleus, some goes down and synapse on the spinal nucleus, and the fiber that are coming from these, they cross the midline and move up, and these are making the trigeminal lemniscus. These are making the trigeminal lemniscus. So you can see it right here, you can see it right here. Next to it will be your very own spinal lemniscus. Spinal lemniscus was the spinothalamic tract was made that entered here, relayed in the substantia gelatinosa, crossed midline, and throughout its pathway it more or less remained on the lateral aspect. So that was the spinal lemniscus. It is spinal lemniscus. It contains the anterior spinocerebellar and spinothalamic tract, posterior anterior spinothalamic tract, lateral spinothalamic tract, and spinotactal tracts that are running inside this. And last but not the least, lateral lemniscus. This is the auditory pathway. I discussed it a little in the Pons lecture, that started with the cochlear nucleus, crossed the midline in the trapezoid decussation, trapezoid body, and then after crossing, those fibers that cross, not all of them cross, those fibers that cross, they are moving up in the lateral lemniscus. Now, if you remember, this inferior colliculus is related to the auditory system, and this is related to the visual system. The lateral lemniscus relays with the auditory relays with the inferior colliculus, and it terminates by going into the inferior colliculus, and after that it will move through inferior brachium and medial geniculate body. I have not discussed those topics with you yet, and that their pathway, that it will go in that line and it will end here. So the lateral lemniscus will be found here, but it will not be found here because it has already exited through inferior colliculus. So that's it. The same structures can be seen on the other side: medial lemniscus, trigeminal lemniscus, spinal lemniscus, and lateral lemniscus. Apart from lateral lemniscus, the three tracts are present on both the levels. Moving on, the next is mesencephalic nucleus. This was the third of the three spine nuclei of the sensory nuclei of the trigeminal nerve. The one that was on the superior in the medulla, that was spinal nucleus of trigeminal. In the pons there was main sensory nucleus of trigeminal, and above in the midbrain there is a mesencephalic nucleus of the trigeminal. It is purely responsible for proprioception, position, and those movements, those signals, sensory signals basically. So it is seen on both the levels. It is seen on the lateral aspect of the periaqueductal gray area, and seen here and here mesencephalic nucleus, and you will be able to see them on the opposite side too. Next, decussation of the superior cerebellar peduncle. As you can see in this picture, this is the cerebellum, and here this crumpled bag like dentate nucleus, this is the one that sends fibers to the cerebellum, to the cerebrum. The dentate nucleus sends axon, and then dentate nucleus sends axons to the red nucleus, to the thalamus, and after relaying on those areas, it goes from the thalamus, it goes up, the signal goes up to the cerebral cortex, and after relaying to the red nucleus, it goes down to rubral spinal tract to influence the different spinal segments. So these fibers are majorly making up the superior cerebellar peduncles. So these fibers. So if the red nucleus is present here at the the red nucleus is present somewhere here at the level of superior colliculi. Thalamus is present somewhere here above. So these fibers, they cross the midline to reach those structures. They cross the midline to reach the thalamus. They cross the midline to reach the red nucleus. And that crossing over is visible at the level of inferior colliculus as we are seeing in this picture. So as we are seeing in this picture. So this is what we are seeing right now, and some of the fibers are crossing over to go to the thalamus directly too. So this is the dentate nucleus. This is the dentate nucleus of cerebellum. This one. So this is called dentato-rubral fibers or dentato-thalamic fibers. So this is what we are basically seeing right here. The decussation of superior cerebellar peduncles. The superior cerebellar peduncles, and that is a very prominent feature of the midbrain cross section at the level of inferior colliculus. Next, let us talk about the upper level, the red nucleus. Red nucleus is present somewhere here at the level of superior colliculus, and it is shown right here. It is present here. It gives rise to the fibers that are going downwards and affect the muscles of the through the spinal cord. So there it is going to give rise to descending tract that is called the rubrospinal tract. As you can see, there is a very big red nucleus that is present here. It is receiving fibers from the dentate nucleus through opposite sided cerebellum and through the fibers coming through this decussation, and it is giving rise to the fibers that are rubrospinal fibers that cross the midline, and because they cross midline from both sides, this is called decussation of the rubrospinal tract. And as we will see in a little while, there are two decussation. So it is more anterior or more ventral of the two decussation. This is the ventral decussation. Then there is a rubrospinal tract. It will start moving downwards, and you will see it going down right here too. And then you had seen it already in the pictures in the cross sections of the pons and even in the medulla oblongata as it moves down. It majorly remains towards the with the corticospinal tract, near to the corticospinal tract. And then these are the fibers of the red nucleus that are going down to the spinal cord, rubrospinal pathway. Then there are other fibers too that are going up to communicate with the cerebrum. So these are rubro-thalamic tract. The fibers were coming from dentate nucleus, relayed in the red nucleus, moved up to the thalamus, and they will move up to the cerebral cortex. There is rubro-thalamic tract. So that's how the red nucleus is relaying information above and through the rubro-thalamic tract, and sometimes that tract is called dentato-rubro-thalamic tract because through this pathway the cerebellum, it's sending its signal, it's sending its input to the cerebral cortex. You can repeat the same things on the opposite side. The red nucleus, the crossing fibers of the rubrospinal tract, the decussation, the ventral decussation. Then there is this rubrospinal tract seen on both segments. Next, in the medial longitudinal fasciculus, this was the vertically running fibers that were interconnecting all the cranial nerve nuclei related to the extraocular muscle movements. Number 3, number 4, and number 6 nerve, oculomotor, trochlear, and abducens. And interconnected with the vestibular and cochlear nerve and in the axial musculature too. Then there is tectospinal tract, the fibers coming from superior colliculus and going down and affecting the muscles of the axial skeleton, visual spinal reflexes in response to the visual stimulus, the response in the spinal cord. You can see tectospinal tract in the lower section. In the upper section, the fibers that are emerging from the superior colliculus, they cross the midline in this decussation. This is the dorsal decussation, the decussation of the tectospinal tract. The fibers come, they cross the midline, and they move down in the tectospinal tract. So it is also a crossed pathway. Next, let us talk about trochlear nerve nucleus. In the lower part, in the B, anteriorly to the central canal, anterolateral to the aqueduct of Sylvius, there is trochlear nerve nucleus. Trochlear nerve emerging from this trochlear nucleus, cranial nucleus number 4, it's very different in a such a way that the axons, rather than going in front like almost all the other cranial nerves, it goes back. Not only it goes back, it crosses the midline and goes towards the opposite side. So this means that left-sided trochlear nerve nucleus, it's going to supply the right-sided the right-sided abducent muscle. So it will go like this, and it will go from the anterior aspect. After winding around the brainstem, it will go to the anterior aspect. Here you can trace the trochlear nerve going from the posterior to the lateral aspect of the trochlear nerve. The same will be the situation of the opposite side, and the decussation occurs in the superior medullary vellum right here. So it can be seen, this decussation can be seen especially when we consider the other sided fibers. Then let us talk about the other cranial nerve nuclei at the upper level, that is the oculomotor nerve nucleus. The oculomotor nerve contains two nuclei here. The main oculomotor nerve nucleus that is going to supply all the muscles except the two muscles that are not supplied are the lateral rectus by abducent and superior oblique by trochlear. All the other muscles are supplied by the oculomotor nerve, and that is the general somatic efferent fibers. In addition to that, the second nucleus of the oculomotor nerve is the parasympathetic nucleus, that is the Edinger-Westphal nucleus, that contains the parasympathetic fibers that are going to help the muscles of accommodation, the ciliary muscles, and the muscles of pupil reconstrictions, the sphincter pupillary muscles. These are the general visceral efferent parasympathetic fibers. These two, the fibers coming from these two, they will both make the oculomotor nerve. By dotted line I have shown the parasympathetic, by solid line I have shown the somatic efferent fibers. Visibly you cannot see them separately, that moves anteriorly to the red nucleus and exits through the interpeduncular fossa as it moves forward. The same can be seen on the opposite side, the oculomotor nerve nucleus, the Edinger-Westphal nucleus, giving rise to oculomotor nerve. So that's most of the tracks. There are some minor things that are still remaining. The pretectal nuclei. These are the nuclei that are present just anterior or anterolateral to the superior colliculus, and these are the nuclei that are responsible for the light reflexes. As you can link to the lecture of the cranial nerve nuclei, it's already uploaded here. You can just search through the YouTube videos. In the oculomotor, the visual reflexes, the visual reflex, they are one of the step in the visual reflex is the pretectal nucleus. So that is the one that is present here. You can see our video on oculomotor on our cranial nerve nuclei, or you can see the visual pathway video that is also uploaded in our channel. Then there are some other nuclei, some relatively lesser known and lesser discussed, to be more. Locus ceruleus, and that is a nucleus that secretes non-epinephrine, and it has a variety of number of functions. Central tegmental tract, that is a tract that connects red nucleus and reticular formation with olivary nucleus below, and then there is the reticular formation itself that contains a variety of nuclei for the different visceral reflexes and arousal and other things. And then there are interpeduncular nuclei that have again a mixed variety function. I'm not going into the detail right now. So that's it. That's all the cross section. That's about the cross section anatomy of the midbrain. We have discussed the cross section anatomy of brainstem in entirety. You can watch separate videos for medulla oblongata and pons, and this video had covered the Midbrain. Thank you so much for listening. If you have any questions, suggestions, and feedbacks regarding this video, please let me know. We will be very happy to answer those queries. You can contact us through our social media handles, through our website, or through the email or through the WhatsApp, whatever method you like to prefer. Thank you so much for listening. Till the next lecture, goodbye.